In this photo, a nurse is taking care of the wounded soldiers. Nurses played quite an important role as the surgeons did. Nurses did simple things like feeding, giving medication, and changing bandages of the soldiers who have been hurt in the war. Harriet Tubman, who escaped slavery and returned repeatedly to the South to help others flee, was also a Union scout, spy, and nurse during the Civil War, and an ardent supporter of women's suffrage. Surgeons were not exactly formally trained, but they used basic medical instruction books like these to perform surgeries correctly. Before the Civil War began, they had physical examiners check out the soldiers to see if they were well enough to join the war. Little did they know, none of the physical examiners were very thorough, so some women ended up sneaking in and not being caught until later on.
If not, perhaps thousands of women served in the armies of both the North and the South without being noticed on their physical exam, which shows how thorough it was to begin with.
I must tell you that we got a female sesh here. She was wounded at Gettysburg, but our doctors soon found her out. I have not seen her, but they say she is very good looking. The poor girl has lost a leg. It is a great pity she did not stay at home with her mother. Union soldier at Army General Hospital in Chester, Pennsylvania, July 1863.
This is a page from a medical handbook that gives directions to amputating a limb. The lack of knowledge about infectious causes of illness resulted in the absence of basic hygiene and sanitary principles. Doctors seldom washed instruments, let alone their hands between patients. Patients were housed in overcrowded quarters. Food and water was often contaminated by fecal material from men and animals. With the crowded conditions, infectious disease were rampant. The most often used tools in amputation is scalpels, scalpel guides, amputation knives, various amputation saws, tourniquets, and the ever-necessary bullet probes and extractors. As you can tell in this picture, the man's right arm has been amputated and he has survived. The fatality rate from having an arm amputation is 14%, which is quite low. In this picture, you can tell that this man's leg has been amputated. The fatality rate from having a leg amputation is 88%, which is much higher than having an arm amputation. That means if you were to have your leg amputated, you'd have more of a chance of dying than having your arm amputated. It wouldn't be as difficult for soldiers to get around as you thought. Companies like these sold artificial limbs so that soldiers could get around much easier. A wide variety of painkillers were available to the Civil War physician, but at the top of this list, the surgeon of the times chose from ether, chloroform, opium and its derivatives, laudanum, and morphine. Ether and chloroform were the drugs of choice for the initiation of surgical procedures to induce the desired insensibility, whereas all but ether were used to reduce the pain following surgery or as a general pain reliever. All in all, the Civil War was the most bloodiest, gory, and disgusting war ever. But without this war, our nation might have not changed. It was at first a fight to preserve the Union, when then changed to ending slavery. People risked their lives for us to have a brighter future. These people knew what they had coming for them: pain, terror, disease, and death. But they did it for our future, for us.